Good morning, everyone. I'm Kate Eggins. I'm the Director of Communication at the Ottawa Hospital. Thank you for joining us. Nice to see some familiar faces here. We're about to get started, but I'll just give you the housekeeping bit that after a couple of speeches, there will be about 10 minutes for a Q&A, and then we'll do a photo op, and then we'll get you out of the hot sun. Okay? Alors, bienvenue. Je m'appelle Kate, et je veux dire que ça, c'est un jour très important pour nous. Tous les jours, quand on parle de qu'est-ce qui se passe avec le campus civique, sont très importants. I want to just quickly turn your attention to this helicopter pad. That's our helicopter pad, and that's our emergency department. So when we have a new campus, that will change. Instead of an air orange arriving with the professionals and paramedics arriving to bring them via ambulance over to the emergency department, more than likely, we'll have a hospital built with state-of-the-art conditions where the helicopter will land on the roof. So, I'd like to, that's something that we're really looking forward to, 5 to plan and 5 to build. So I'd like to just bring a warm welcome to everyone who's come here today. In particular, I'd like to welcome Jeremy Roberts, Parliamentary Assistant to the Minister of Children, Community and Social Services, as well as the Minister for Long-Term Care, Dr. Marilee Fullerton, and the Deputy Premier, of course, our Minister of Health, Christine Elliott. I'd like to call Christine Elliott to come up, say a few words.
Bonjour, good morning everyone. It's a pleasure. Thank you very much for joining all of us here at the Ottawa Hospital Civic Campus. I'd like to extend a particularly warm welcome to my colleagues, Marilee Fullerton, the new Minister of Long-Term Care, as well as to Jeremy Roberts, our MPP, who's doing a wonderful job in the Ottawa area. The Ottawa Hospital is such an important part of this community. Not only does it carry out the essential functions of a hospital, it is the only hospital in the Ottawa and Champlain region providing complex specialized services and offering neuro and vascular surgery. I want to thank all the nurses, all the staff, all the doctors, patients, family, advisors, and volunteers for the incredible work you do to ensure that people here in Ottawa receive the best possible care. And just as a side note, I would like to say that I did visit the hospital during my previous job as patient ombudsman, and I was really struck by how important the patient experience was to everyone in providing care here. And that went from the very top, from Dr. Kitts to everyone who worked at the hospital. And so when I was talking about providing integrated care based on the patient, this was the prime example that I would use to speak to people about what we need to achieve in creating that kind of care. So thank you very, very much for the work that you do and for the example that you showed me in how we should be providing care in the province of Ontario. So, we all know now that our healthcare system is undergoing a significant series of pressures. The system simply doesn't have the right mix of services, beds, or digital tools to be ready for a growing and rapidly aging population with more complex care needs. As a result, patients and families across Ontario are getting lost in our healthcare system. They're falling through the cracks, and they're simply not getting the healthcare services that they need. That's why our government made a commitment to the people of Ontario to build a modern, sustainable, and connected public healthcare system that is focused on the needs of patients and on ending hallway healthcare. And today, with my colleagues, I am proud to announce that our government is renewing our commitment to support the redevelopment of the Ottawa Civic Facility. We are providing an additional $9 million to support the ongoing planning for the redevelopment of the Civic Campus to bring the total planning grant to $12 million. Thank you. This commitment is part of our government's overall plan to invest $27 billion over 10 years to build new and expanded hospital infrastructure within the province. When completed, the new state-of-the-art teaching facility will recreate and reflect the high-quality specialized care that is delivered at this hospital and will create more capacity and reduce wait times. Patients can expect to benefit from expanded services for emergency care, inpatient care, and specialized regional programs such as trauma, neurosciences, and vascular surgery. This investment is another example of how our government continues to deliver on our commitment to end hallway healthcare and build a modern, connected, and sustainable public healthcare system for everyone. We did take a big step forward with our long-term plans to strengthen Ontario's public healthcare system with the passage of the People's Healthcare Act in April of this year. This landmark legislation is a key component of our government's plan to finally build a modern, sustainable, and integrated public healthcare system, one that is truly focused on the needs of patients. Under our plan, we will organize healthcare providers to work as one coordinated team focused on patients and on the local needs of communities such as yours here in Ottawa. We envision a system where family doctors, hospitals, home and community care providers, and long-term care providers work together as a team, where within these teams, providers are encouraged and enabled to communicate with each other rather than just communicating in silos only with the government, and are dedicated to creating a seamless care experience for the patient and his or her family. A system where patients are supported when transitioning from one healthcare service to another, where they don't have to tell their story over and over and over again because there is one patient provider and one care plan. I know there is great collaborative work organizations have already done to support patients and families transitioning from one healthcare provider to another. Here in Ottawa, your hospital's Interprofessional Spine Assessment and Education Clinic, or ISIAC, offers patients integrated care for pain management. Models such as this ensure that patients have the right levels of support in the right place with an integrated, collaborative health team that can include nurses, family doctors, personal support workers, physiotherapists, occupational therapists, and social workers. As a result, patients are experiencing immediate relief from their serious conditions, helping to improve outcomes and the community benefits because it helps free resources, reduce wait times, and ends, or at least helps to end, hallway healthcare. So today I want to commend and congratulate the teams that made the ISIAC a reality. This is the kind of collaborative work that we want to see evolve as part of an integrated team in a fully connected system. If we expect real improvements that patients will experience firsthand, we need to address the capacity pressures of the system and make sure that we have the right mix of services, beds, and digital tools. As we modernize our healthcare system, our government will continue to focus on healthcare investments where they will have the most impact, on frontline services that directly support patient care. As we do so, we will continue to seek the advice of patients, families, and frontline caregivers like many of you here today, and others who work on the front lines of our healthcare system. Together, we will all create a connected system of care where every Ontarian is supported through every step of their healthcare journey, and I certainly look forward to working with you to make this a reality. So thank you very, very much for being here today.
And now a couple of words from our CEO, Dr. Jack Kitts.
Thank you, Kate, and welcome all of you. Thank you for coming. A special thank you to Deputy Premier Elliott, and thank you for your long-standing commitment to healthcare in Ontario, and you described the vision for the future extremely well. Building a new hospital is an opportunity of a lifetime. And for our wonderful staff, many of you here today, and the community we serve, today is really a dream come true. For Ottawa, this means that we are building one of the most significant infrastructures projects our community has ever seen. The Ottawa Hospital's vision is to provide each patient with the world-class care, exceptional service and compassion that we would want for a loved one. And to achieve our vision, thanks to our very generous community, we have state-of-the-art technology and equipment. We have world-first researchers who are doing world-first discoveries. And soon, with this announcement, we will have the modern facilities designed to be safer, more efficient, and environmentally friendly. Our new facility will enable us to attract the best and brightest minds and hearts in healthcare to Ottawa so we can continue to provide our patients with world-class care for generations to come. Today's announcement is a giant leap forward into 21st century healthcare. This means that the Ottawa Hospital is an integral part of a health system where all health service providers work together in teams, Ontario health teams, focused entirely on the patient, providing access to care when and where they need it. And that means no patients should have to be cared for in a hallway in the future. Deputy Premier, members of the Ontario Legislature, Mary Lee and Jeremy, thank you for joining us today. On behalf of the staff and the management and the board of the hospital, we cannot thank you enough for all your hard work. By supporting our new hospital, you're supporting healthcare and healthier communities across our region. You're helping us shape the future of healthcare, which you just described a few minutes ago. So thank you very much.